birthday party today. I wanted to grab you two real quick because I wanted to talk to you about something for school. And quickly, it's not going to take long, but we're going to talk about one of the national patient safety goals. And the part that I want to talk about is an ambulatory surgery. It's talking about recording and passing along the correct information about a patient's medication history. We've got to find out what medication the patient is taking and compare those to what the patient's chart has documented. So that's what we're going to talk today. The importance of this goal is, of course, patient safety and positive patient outcomes. By confirming the patient's medications and documenting them in the patient record, all hospital staff is aware of all current treatments. This also ensures when a patient is receiving moderate sedation that the nurses giving the sedation are aware of all current medications, especially any type of narcotics that the patient takes at home. I got a scenario that I want to tell you about, and Heather, I don't think you were at the hospital the other day. I think it was your day off, but we had a patient come in, and she apparently did not give the nurses the adequate medication history, and it was not documented correctly in the Cerner system. And when she came back and had her colonoscopy done, we had a really hard time getting her sedated. Upon looking through her chart, we noticed she takes tramadol, hydrocodone, and morphine. That was not documented in the Cerner system, so therefore we did not know that she was on these medications, and she was not adequately sedated for her colonoscopy. She was awake, she was in pain. So if we would have known about those medications, we probably would have done her medications, her sedation a little differently. So that's why I wanted to kind of talk about this particular goal, is because of what happened the other day. Some stuff that I've read in regards to trying to help prevent this is doing a bedside patient report. Doing it at the bedside, talking to the patient, talking to the patient, talking to the family members and the other nurse. Talking to both of those will help the family. If we have any errors in our documentation, they can come in and they can help us with that. But we can also, like I say, involve the family member, make sure everything is correct in the patient's chart. And this right here is particularly just talking about how important that is in regards to doing it at the bedside. And then this right here is talking about a study that happened in regards to in a pediatric setting. Patients were not getting the correct medication reconciliation at the bedside. The patients, according to this, they had 20 patient charts. 10 of those charts had medication error. The medication reconciliation was not done adequately. So that is affecting patient safety. So we need to make sure that we document and ask the patient the appropriate questions in regards to get their medications documented accurately. And then another study I found was trying to give teaching new students, new nurses coming in how to do a proper medication reconciliation, and also maybe giving them a checklist of asking for the correct name, the dosage, how many times a day they take it, and all that, to make sure all that's documented, because it is important to do that. So just to conclude, the reason why I chose this safety goal is because I feel like it affects us every day in our department. We need to make sure we have patients that come in, they have accurate medications charted and documented, so we, the nurses that sedate them during their procedures, we make sure we can get them adequately sedated and they're comfortable during the test. Making sure we do bedside reports, I think, will help. Making sure we involve the family members, making sure we have everything correct on the patient's chart. And then trying to make sure all the staff, we have a lot of incoming staff coming in, a lot of staff changes that we've had here in the past couple of months. We got new nurses. We just got to make sure those new nurses are trained and know how important it is to make sure that these medications are documented accurately. And it's for the safety of the patient, and that's the number one. That's our number one priority, is their safety. thank y'all for letting me talk to y'all for this quick little session. If y'all have any questions, don't hesitate to come to me and ask, but I appreciate your patience. Thank you.